Warm greetings to one and all. I am Dr. Elizabeth KE, former Professor and Head, Department of Pediatrics, Government Medical College, Trivandrum. Currently, I am working as Professor and Head, Sri Moogamika Institute of Medical Sciences, Kulashegura. I am extremely happy to be part of this year's World Breastfeeding Week celebration, and I express my gratitude to the office bearers of IMA Marthandam, all seniors and friends. As you all know, the Breastfeeding Week is celebrated from August 1st to 7th every year. And this year the theme is Support Breastfeeding for a Healthier Planet. As you all know, in 1992, the Baby Friendly Hospital Initiative BFHI was started. Baby Friendly Hospital has many limitations. The average stay of a newborn baby in the hospital is maximum 2 to 3 days in normal delivery and 5 days in cesarean section. It is not possible to teach everything and empower the mother for exclusive breastfeeding for 6 months and to continue breastfeeding till 2 years. And it is very interesting that the first 1000 golden days in a baby's life is from the day of conception to the second birthday. And this is the time when maximum body growth, height gain and brain growth are happening, and myelination also. So breast milk has to be given to the baby. There are 10 steps to be observed, and it is the duty of the public to see that all these are implemented. And the first and foremost is the hospital policies. Every hospital should have a written policy to promote breastfeeding as the standard practice of care. And they should not promote infant formula, bottles and TEATS. The second is staff competency. Train all staff, right from doctors, nurses to cleaning staff and security force regarding breastfeeding and the importance of that. And the third is antenatal care. The mother will have to be given classes on the benefits of breastfeeding and about her nutrition and the nutrition of the baby. This can be done through one-to-one discussion or focus group discussion with a group of mothers, health talks, display of posters, pamphlets, and by observing Baby Friendly Hospital Initiative days and Breastfeeding Week celebrations. And in the third trimester, there should be a nipple protractility test done to look for inverted nipples. And some remedial measures will have to be started immediately after birth. This can be done with a double syringe technique. Previously, we used to do a cut syringe technique, which is very difficult to do. In the double syringe, we take 10 or 20 ml syringe, 2 syringes, and then attach it with a rubber tubing which is available in our IV drip set. And one with piston, one without piston. The one without piston will go to the breast and the other will serve as a reservoir. And when there is retracted nipple, we can try this. We can also get express breast milk this way. And mother can be taught manual expression or even with a breast pump. And the fourth one is care right after birth. We have to give skin to skin contact. Mother should see, touch and give breast milk to the baby immediately after delivery. And this should be promoted. And baby can, if the baby is put prone on the mother's abdomen and chest, baby can crawl to the breast. This is called breast crawl. This will initiate breastfeeding. And the fifth one is support the mother. We have to give the desired help to the mother, and some of them may need help in positioning and in attachment. And a proper positioning is in where the baby and the mother face to face. And there is tummy to tummy, chest to chest, chin to breast, mouth to areola. That is the position that is best positioning. And this is called cradle position. We can also try cross cradle, and in small babies, we can have the clutch method or the football method where the baby is coming from the underarm towards the breast. And twins also can be fed in that way. And we have to ensure good attachment. And the LATCH score is more important than the UPGAR score. And in LATCH score, if the mother gets 10 upon 10, breastfeeding will be very successful. If the score is less than 7, the mother needs help. And LATCH has got 5 components. L stands for latch, that is correct attachment to the areola. And A stands for audible swallowing, and T stands for type of nipple, that is whether it is inverted, everted, etc. Then C stands for the comfort of the mother. Is it painful for her or not? And H stands for the hold or the help she needs for holding the baby. So it is a good practice that we do the LATCH score, and if any mother falls less than 7, the mother should be supported. And when there are common feeding problems, we will have to address that. No milk, that is the first complaint. And here we should understand the physiology of lactation. Lactogenesis happens in 3 phases. Lactogenesis 1 is during the antenatal period, 16 to 22 weeks onwards, where the breast gets prepared for lactation. And lactogenesis 2 is the first 2 to 3 days, 20 to 30 hours. Then only very scanty colostrum or milk will be coming, 10 ml, 40 ml, 100 ml, like that. And as you go on suckling the baby, this milk coming will increase. And at this point of time, everybody wants 500, 200 ml of milk to come and say no milk. And that is, we cannot jump the physiology. And then it goes to lactogenesis 3, that is after the 3rd day. And copious milk production will be there. The 6th step is supplementing. Give only breast milk to the baby unless medically indicated. We have to sing a song of STOPS, S-T-O-P-S, that is sensorium, temperature, oxygenation, perfusion and sugar for the newborn baby. If any one of these is lagging, we will have to intervene. So if sugar is not maintained, we can give supplements. And we must teach the mother how to express breast milk. It can be done manually. We have to rotate the finger around the areola and then stretch the nipple vertically and horizontally, and then with 2 fingers on the areola, milk can be expressed. It can also be done with a hand held pump or an electric pump. And expressed breast milk can be stored for 4 hours in room temperature, 24 hours in the refrigerator and several weeks in the freezer. And even mothers with COVID-19 can breastfeed. So far, no evidence is that it comes through breast milk, but it can be vertically transmitted from the mother to the baby in utero. And the 7th point is rooming in. Mother and baby should be nursed in the same room. This will build confidence and will help breastfeeding, and the baby also will be safe in this position. And the 8th one is responsive feeding. Previously, we used to say that we should practice scheduled feeding 2 hourly, or then we said demand feeding. So babies had to cry to get milk. But now we focus on responsive feeding. Look for the hunger cues. When the baby is crying for milk, there will be hunger cues, early cues, mid cues and late cues. The early cue is that the baby will open the mouth and then will move the chin as if for rooting. In the mid cues, the baby will stretch the hands, take the hand to the mouth. And in the late cue, the baby will cry. Once the baby cries, the baby will have to be calmed, and then only breastfeeding will be possible. So responsive breastfeeding is what we are now recommending. And 9th clause is bottles, TEATS and pacifiers say a big no to all these things. And the 10th is discharge policy. And the mother and the baby should be discharged only if the mother is empowered to have a good LATCH score and feed the baby by herself. And we should have feeding places in the railway station, bus station, mall, etc. Now we have only it in the airports. Let us pledge our commitment to support breastfeeding, which is the foundation of life. Thank you very much for the patient listening.